The member from Don Valley East.
Thank you, Madam Speaker. It's always a pleasure to rise in the House to discuss the issues that worry my constituents in Don Valley East and across Ontario, especially as it relates to something that is as important to all of us as health care. On this occasion, I am speaking about Bill 135, the amendments to the Connecting Care Act, which aim to provide some material changes to home and community care services here within Ontario. My remarks will focus on 5 things. Number 1, the status of home and community care here in Ontario. Number 2, how this poor status came about. Number 3, we'll review some of the recommendations from stakeholders. We'll see, number 4, how Bill 135 doesn't meet any of those recommendations. And finally, number 5, I will discuss exactly what is wrong with Bill 135. So let's begin with the status of home care here in Ontario. There's no way to mince words here. It is a dysfunctional system marked by severe staffing shortages, high staffing turnover, frequent changes to nurses and personal support workers, and a remarkable, not in a complimentary way, a remarkable amount of rationing of care with less time spent per patient visit. Now, in order to illustrate this, I'd like to share the story of one of my constituents. And this constituent happens to be my constituency assistant. His father is bedbound. His boss, me, is a member of provincial parliament. His boss is a family and emergency doctor. And despite all of those levers, we still cannot get my constituency assistant's father the home care services he desires, that he requires. And this is a situation that has arisen the moment this government got its grips on home care. How did this come about? Well, it boils down to a few things. We have a demoralized workforce that is burnt out from the pandemic, that has moral injury from rationing care. They've been rationing care because this government hasn't been able to retain healthcare workers, doesn't have a strategy to retain healthcare workers. We also have a problem with the proliferation of for-profit private healthcare, again, impacting the retention of healthcare workers, imposing wage restriction, wage suppression to squeeze out profits, offering part-time work instead of full-time work so as not to pay out benefits, delivering lower quality, rushed care, public paying for private gain. And then, of course, we have systemic underfunding. Systemic underfunding marked by Bill 124, leading to the proliferation of for-profit nursing agencies and staffing agencies. We have a government, this government, that isn't even willing to accept money on the table from the federal government, $1.7 billion to raise wages for PSWs. They will not do it because they do not respect healthcare workers. And of course, we have consistent and repeated overpromising. Commitments of $1 billion given in the 2022 budget for home care, of which only about $150 million was released. And then in this year's budget, a promise to deliver $569 million, although the last time the FAO reported on this government spending, they had already underspent by $1.2 billion. Okay, so this is how we got there. Ignorance, a lack of competence by the current government. We already have a roadmap from many stakeholders, stakeholders such as the Ontario Community Supports Association, which has said that a mere 10% wage increase would result in an extra almost 1,300 PSWs, would retain 1 in 5 PSWs that is about to leave. They've said we need to achieve wage parity between home care, community care, long-term care, and the acute care sector. And they have said, and I agree, that we need to pay workers for all the hours worked, not just the ones in direct patient care. This year, we've seen an increase to 76% of organizations saying that the health human resource crisis and inflationary pressures have forced them to either cut services or increase wait lists. Bill 135 ignores all of those things. Rather than doing any of those things, it puts the proverbial head in the sand. It ignores the root causes of our problems. It's the equivalent of throwing darts at a dartboard in the hope that something sticks. Every single one of the fundamental problems plaguing our home care system is completely ignored. It does this because if anything, it makes things worse. It demolishes the existing home care architecture, eliminates 14 local health integration networks, and replaces them with a half-baked, poorly conceived, monolithic alternative that hasn't been fully thought out. It proposes to provide home and community care services to patients, proposes to deliver operational supports, proposes to provide information to the public about health and social services, and proposes to provide placement manages services. Those are lines on a piece of paper. How it proposes to deliver those things? No idea. I met with ministry officials, asked them to tell me concretely, what will it do, and was met with nothing but business power words like integration and connected care. What does that mean? Why does this monolithic institution think that it can perform these tasks better than local health integration networks? Never clarified. It might, but if history is a judge, that is an unlikely proposition. We saw when Ontario health teams were proposed, they were delivered in a patchy, lumbering rollout that took place in an entirely ad hoc manner, lacking in consistency. Now we actually see that was an attempt to decentralize services. This is an attempt to centralize services. We can't even figure out a consistent pattern on the direction we want our healthcare system to move in. And the point is to centralize services with an expectation that I don't really know. What I can tell you is that the last time we faced a process like this was when we tried centralizing autism intake services under the umbrella of Access OSP. And that has subsequently proved to be an entire disaster with skyrocketing wait times and a ballooning list of kids exceeding 60,000. I could go on and on and on, but I don't have the time. When I asked the ministry for an example of a single concrete problem that this reorganization would solve, no answer. So pick your metaphor for this bill. It's centralizing at one level, decentralizing on another. Lipstick on a pig, as my colleague said. Shuffling the deck chairs on the Titanic. A tale of sound and fury signifying nothing. I don't know. It centralizes powers, and the minister who can just reward her friends, as we've seen with the Greenbelt.
Thank you.
Anyways, I welcome your comments.
Questions? The member from Newmarket Aurora.
Thank you, Madam Speaker. And my question will be to the member from Orléans. So I have to tell you, my mind is a bit boggled right now. Under the previous Liberal government, you were cutting nurses. You were leaving our hospitals lacking in infrastructure, in disarray. There's 14 separate home care organizations. It's in fact the home care organizations that have been asking this government to make a change, to make it centralized. It's this in government who's been investing $80 billion this year in this healthcare system. So I have to say, instead of navigating 14 separate home care organizations and waiting for a call at home, now this at-home program will be a one-stop shop that provides people with easy access.
Response? Member from Orléans.
Thank you, Madam Speaker. After 5 years of government, the government should actually take responsibility for the things the government is or is not doing. And one of those things is the provision of adequately funded home care. Now, the government member says that their administrative reorganization of home care will somehow make things easier. Well, I don't recall the administration reorganization of how license plates are done making anything easier in Ontario, Madam Speaker, or frankly any of the other administrative changes this government has tried to make. I don't remember. In fact, I think we're seeing lots of problems with the administrative changes they made around the sale of cannabis in our communities, Madam Speaker. And so if they think administrative changes are going to provide more home care, they need to spend less time here at Queen's Park and more time out in their communities.
Thank you. Question, the member from London Fanshawe.
Thank you, Speaker. And this is something that's very important because our senior population is going to exponentially get bigger over the next 10 to 20 to 30 years, and home care is an essential piece. We know that when we speak to people who need care, their first preference, especially a senior, wants to remain at home. And under the Conservative government, home care used to be not-for-profit, and then Mike Harris government changed all that and privatized it, and the Liberals, quite frankly, weren't any better. They continued that privatization. So I want to ask the member, would this member advocate and promote and actually make policy changes so that home care is not-for-profit and there's not a profit extrapolated out of caring for vulnerable seniors at home and many other people at home. Would you support a not-for-profit policy in home care in this bill?
Thank you. Response?
Thanks very much, Madam Speaker. In fact, in the last election, we proposed a dramatic change to home care that would ensure that it was not-for-profit and based on a more community-centered and community-based model. So, of course, I think if there is government funding available, that funding should go to helping people directly by hiring PSWs, nurses, other support workers, the things that they need. If you have a profit center involved in that, obviously those people are skimming off the top, and there's less money available to support people where they live. Thank you, Madam Speaker.
Thank you. Question, the member from Perth Wellington.
Thank you, Speaker. My question is to the member from Don Valley East. Speaker, I know that member was not here under the previous Liberal government, and I wasn't here in this place either. I find it rich coming from the member opposite, talking about everything that our government is doing for health care when they did nothing for 15 years, absolutely nothing. When they tried to reform home care, it was a bullet point in a press release, Speaker. Speaker, I wonder if, as was mentioned in the news release, the goal of this legislation is to create integrated service organizations with home care. The Ontario Health Teams, which has been well received by stakeholders in the audience, or in the province, Speaker. Speaker, I want to provide one more quote from a website, and it's a bullet point. Promote coordinated care by establishing an integrated model for continuity of care. Speaker, that bullet point is from Bonnie Crombie's leadership website, which this member endorsed. Will he support this bill?
Thank you. Response?
Well, that's a bullet point on a leadership commitment. That is not a full-out bill. Now, when I asked ministry officials to explain how they were going to deliver on those business power words, they couldn't tell me. And while we're talking about the things that have or have not been done, let's talk about what this government has accomplished. It has accomplished 2.2 million Ontarians without a family doctor. It has accomplished a backlog of medical services that exceeds 22 million. It has accomplished rampant ER closures in almost every community across this province, including in the Minister of Health's own riding. That's not a track record to be proud of. Now, I would invite you, Madam Speaker, through you, I would invite members of the government to tell me exactly how they propose to actually deliver integrated, connected care, apart from just listing bullet points and finding things off of websites.
Thank you. Questions? The member from Niagara Falls.
Thank you, Madam Speaker. And I always like to stand up here and tell the truth, and I'm not really sticking up for the Liberals, but the reality is, under Mike Harris, you laid off 6,000 nurses. Let's be clear on that. And you closed multiple hospitals. So let's at least be accurate and tell the truth on that particular issue. But I see the Labour ministers here, so I'm going to ask this question to the Liberal, hoping that he hears me. This bill does not guarantee that the Ontario Health at-home workers will be unionized or full-time positions with real wages, real benefits, and pensions. So my question to the Liberal, either one, doesn't matter who answers, do you believe that people that work in home care should be unionized, should have full-time jobs, should be respected, should have pensions, and belong to a union? Because if you want to improve wages, you need to join a union in this province.
Thank you. Response?
Thank you very much. I fully believe that the workers who are in home and community care deserve the protections in whichever form they see fit. They deserve to have full-time work instead of just getting offered, piecemeal part-time jobs. They deserve to be paid properly, and they deserve to be paid well. They do not deserve to be subjected to Bill 124. And I think I'll leave it at that. They deserve the full protections.
Thank you.
Whatever
Questions?
they choose.
The member from Mississauga, Aaron Mills.
Thank you very much, Madam Speaker, and I would like to direct my question to the member from Don Valley East. I understand he's a doctor, and his question was about what this government did to extend the primary care, or how many millions of Ontarians don't have doctors. And I would like to put the question back to him. I am as a one victim of this. My wife took 7 years outside the province to be able to get her license here. She is a doctor, It took her 10 years plus to be a doctor in Ontario when we, at the time, connected to the Minister of Health at the time, was Liberal, and he said, we can't do anything, we don't have spots. Not only that, all the IMGs across the country have 24 spots to get internship in this country during the Liberal times. So my question to you, if you are comparing us to you, can you tell us what the Liberal did in about 13 years of work?
Thank you very much. Response.
Thank you, Madam Speaker. I actually think that question is best directed to the Minister of Health, because under the previous Liberal government, we developed a practice-ready assessment program. It was ready to go in 2018, and then the first thing that happened when this Premier and the past Minister of Health came into power is that program was eviscerated. And in August of 2022, when that Minister of Health asked the College of Physicians and Surgeons of Ontario how to get more doctors licensed in this province, they said bring that program back, the same program that this government got rid of. And ever since accepting that commitment, we've heard over and over and over in this chamber that the practice-ready assessment program is coming back.
Response?
And yet every time I talk to the College of Physicians and Surgeons of Ontario, they have heard nothing from the Minister of Health and this Premier.
Thank you. Very quick question. Associate Minister of Housing.
Thank you, Speaker. My question is to the member of Don Valley East, and I would say there's one power word, a business power word, that I would respectfully submit, and that is the word accountability. And for the first time in about 15 years, this government's accountable. We're trying to make changes.
Question.
We believe that home care is the best. So what part of this bill do you support instead of being against it?
Thank you. Response.
Thank you, Madam Speaker. I'm glad the member across mentioned accountability, because actually this bill doesn't have any. The minister can appoint whatever director she wants on the basis of whatever criteria she wants. Can set whatever regulations she wants without any sort of oversight, prioritizing and concentrating all power in the Minister of Health as opposed to working with the public or stakeholder organizations. There is no accountability.
Thank you.